This video presentation represents the second part or follow-up to our earlier video, Diabetic Neuropathy, What, Why, and How. We will discuss measures you can take to prevent diabetic neuropathy and briefly mention treatment options. A separate video will cover treatment options for diabetic neuropathy in more detail and will be coming up soon.
The key message is to prevent diabetes neuropathy from developing in the first place. Because once it's developed and established, it's hard to reverse, and frequent infections and amputations become more likely. So in this diagram, I outline some of the preventive steps. Some of them are common sense. For example, controlling blood glucose is important so your neuropathy does not develop or does not progress. If you smoke, quit smoking. Because smoking affects your blood flow and compounds the problem. Limit alcohol because alcohol is toxic to the nerves. Keep your blood pressure near 120/80, and if your cholesterol and triglycerides are not controlled, control them. Lose weight. So in this diagram, there are certain principles outlined that are very useful for patients to avoid some of these complications. And I often provide these tips to my patients. So make a note of these. Number one, if you have diabetes, do not walk barefoot, particularly if you have neuropathy, because you may not be able to feel sharp objects that may cause injury that you may not feel, and that can become a problem down the road. Either you or your spouse should look at your feet at least once a day. This will help identify cuts or redness or sores or blisters or calluses at an early stage where you can seek help from the doctor. Wear clean socks and avoid tight shoes. Make sure you wear socks with shoes. Before you put on your shoes, take a look and check them to make sure there are no small objects that you may not feel that may injure your feet, such as splinters or pebbles. Your feet are more likely to get dry when you have diabetes, so use moisturizer regularly. It's important to note that if you are putting moisturizers, do not put them between your toes because that area can get macerated and more prone to infections. If you're cutting your toenails, be careful not to cut too close, and if possible, see a podiatrist to take care of that. And then if you were to develop any new calluses or ulcers, or if you have ingrown toenail, call the doctor, have him take care of it. Don't do it yourself at home if you have diabetes because it may aggravate the problem. In discussing the management of diabetic neuropathy, the first step is to treat diabetes itself. Because if you do that, even if you have neuropathy and it's early, you can prevent progression or slow it down. And this includes taking your medicines regularly, eating a healthy diet, regular exercise, but at the same time avoiding alcohol, tobacco use, like I mentioned. Your vitamin B12 should be tested, and if it's low, you should get vitamin B12, particularly if you are on metformin or glucophage for a long time. Your blood pressure and cholesterol also should be controlled well for management of neuropathy. What if you develop neuropathy with pain? The pain can be mild, moderate, or severe, and therefore you may need to treat the pain. What are the options to treat the pain? It depends on how severe it is. So if it's mild, your doctor may prescribe or recommend simple over-the-counter pain medications such as ibuprofen or Tylenol. But more specific treatment for neuropathy include certain antidepressants or anti-seizure medicines that reduce pain. What they do is they modify transmission of pain impulses through the nerve cells or modify the processing of these painful stimuli in your spinal cord or brain. Because they work in that capacity, there are some side effects that you may experience. So typically your doctor will start a low dose of these medication and then increase gradually. Some of the examples of these medications include amitriptyline or Cymbalta or duloxetine. It's important to understand that when your doctor is giving you these medications, the dose can be different than the dose of these medications used to treat depression. Many patients feel stigmatized taking antidepressants, so it's important to understand that the use of these two medications in this circumstance is really for neuropathy, and the doses are different. Similarly, for gabapentin or Lyrica, the two anti-seizure medications commonly used for the treatment of diabetic neuropathy, the doses may be different. For example, for gabapentin, sometimes the dose required can be quite high in patients with neuropathy, and the doctors will gradually increase the dose when they're using gabapentin to treat neuropathy. This slide outlines some of the other treatments that are available for patients with diabetic neuropathy. So there are topical creams or topical agents such as lidocaine patch, which is topical anesthetic. It's quite useful if the pain is located along a distinct nerve site. Capsaicin is a cream made up, which is derived from pepper. So initially, when you apply that, it can cause pain, but over time, it actually reduces the transmission of pain. For some patients, TENS units, which uh, provide electrical impulses, small electrical impulses to the feet and legs, can modify pain perception and can be quite useful when medicines don't work. Then there are certain supplements that are touted to help patients with neuropathy. Usually they help for people. They're helpful for people with mild neuropathy, and the two main ones are the alpha lipoic acid, which is an antioxidant, and acetyl L-carnitine. Vitamin B12 helps if you have B12 deficiency, but if you do not have vitamin B12 deficiency, it may not have any effect. There is a product called Metanex, which is a proprietary combination of vitamin B12, folic acid, and B6, and it is quite useful in my experience in treating diabetic neuropathy. And finally, some people respond to acupuncture. It's important to understand that whatever method we choose to treat pain, the response can be partial and sometimes slow, so you and your doctor will have to be patient to gradually increase the dose and monitor for symptom relief.
So the take-home message of this video is that diabetic neuropathy is a serious complication, but it's preventable. Prevention is the key. Before you have neuropathy, if you manage diabetes well, you can prevent neuropathy from occurring, and if you have neuropathy, you can prevent complications or consequences of neuropathy by meticulously managing your diabetes, by caring for your feet, and by regularly getting checkups with your doctor. So any problem can be addressed in early stages. I hope this information was useful to you and would help you better manage diabetes and prevent its complication. Goodbye and good luck.
This video is for informational purpose only and is not intended to serve as a substitute for consultation and medical treatment. Please contact your healthcare provider about any questions pertaining to your specific condition. They would be able to provide you with answers and recommendations that are specific and accurate for you. Good luck and thank you.
you.